Welcome back to part 2 of your chapter 18 lecture for ALH 3, Pharmacology Clear and Simple. And we are so close to done. We're almost there. So we are on comprehension check 4. If high levels of oxygen are administered to a patient with COPD, the patient may... All right. I'm going to give you those answers at the end for all the comprehension checkpoints. Let's look now at respiratory stimulants. For patients who have problems with apnea, periods of breathing cessation, medications to stimulate the respiratory center of the brain may be prescribed. So the most common patient that suffers from apnea is a premature infant, and this is because their brain is not completely developed yet. That's why these premature infants sometimes require a little nudge to breathe. So this can be done via caffeine citrate, or theophylline. Drugs have been created for smoking cessation. Smoking tobacco is addictive. It can cause many illnesses such as emphysema, lung cancer, bronchitis, and not only in the smokers, but also those around them. And for these reasons, medications have been developed to facilitate smoking cessation. These aids contain small doses of nicotine to help the individual gradually withdraw from the nicotine use. And the drugs are available as transdermal patch or gum. And other drugs used for smoking cessation include an antidepressant, Wellbutrin, and a newer oral medication that convinces your brain that smoking is not pleasurable. So that is Chantix. And for the Wellbutrin, it is taken orally. It is an antidepressant with significant benefits in smoking cessation. There is a serious risk of suicidal ideation and completion, so it's important that patients are aware of this when they're taking this medication. And again, Chantix convinces the brain that smoking is not pleasurable at all. Patient education is important because they need to know to not smoke during treatment because this could cause a nicotine overdose, and also that patches should not be worn inside an MRI machine. And that concludes the lecture, so I'm going to slide back up here and see if I can go through, oh my goodness, where's the first one? I wanted to go through the comprehension checks with you. So this is where the exchange of oxygen and carbon dioxide takes place. You should have selected C for that one. And then we'll go to checkpoint number 2, hopefully. The type of medication that suppresses cough is, you should have selected A. Oops, I skipped to checkpoint number 4. Let's see if I can go back to checkpoint 3. Xanthins are examples of which type of drug? That was B, bronchodilators. And then now we can go down to 4. If high levels of oxygen are administered to a patient with COPD, the patient may, and you should have selected D, stop breathing. And remember, that's because of this slide here. COPD patients breathe in. They breathe in the response to lower oxygen levels. And if given too much oxygen, they can stop breathing. So a normal healthy patient breathes in response to the rising of the carbon dioxide levels. With the COPD patient, they breathe in response to the lower oxygen levels. And that's it. Have a great day, and I'll see you in class. Bye-bye.